we know about EMFs. Everybody's worried about EMFs. I call them environmental magnetic fields, but EMF stands for electromagnetic fields. So EMFs are environmental, and they are basically broadcast into the environment. You got a microwave tower that's broadcasting a cell signal, or you have radar, or you have television signals, or you have radio signals. They're all broadcast in the environment. They go out into space, basically. They bounce off the ionosphere. And the reason they're a problem is because they're high frequency, typically. And that means that they get absorbed by the body. So whatever is in the way of that field, whatever stands in the way of that field is going to absorb that energy. And so that the EMFs, because they absorb, they create heating. And the irritation, the signal is irritating to the DNA. It could disrupt DNA. So that's why those signals can be harmful to the body, especially high intensity exposures or chronic long-term exposures.
Welcome to the PEMF Effect, where breakthrough science helps take control of your health. I'm Dr. William Pawluk, and I'm here to guide you in tapping into the power of PEMF therapy for recovery, vitality, and total body wellness. From overcoming chronic pain, optimizing brain health, boosting energy, and aging with strength, this podcast is your path to cutting-edge solutions for lifelong well-being. If you're ready to move beyond symptom management and tap into your body's natural healing ability, you're in the right place. Let's dive in. Today's episode is a previously recorded session from a summit where I was a guest speaker.
Welcome to another episode of Mycotoxin, Mold, and Chronic Illness Summit. I'm your host, Dr. Ann Shippey, and today I get to share with you Dr. William Pawluk. He's a physician, an MD. He's in the Baltimore area. He's been through the academic ranks at Johns Hopkins and the University of Maryland. He's been studying this topic for 30 years, and I think you're really going to find it helpful because he's an expert on PEMF, which is so important for pain, getting to the root cause, and actually helping the body to do repair. So with that, Dr. Pawluk, I'd love for you to tell me more about this topic and how you got to this wealth of knowledge that you have.
Thank you very much, Anne. I appreciate you having me on your summit to talk about PEMFs and mold and so on. So my background as a family physician, former family physician, I was a medical director for a group of family doctors, the biggest group of family physicians on the whole East Coast, 14 of us. So I developed that group.
That is a big group.
from scratch. That is a big group, especially for family physicians outside the academic or university settings. So we shared patients, we rounded on patients in the hospital all the time, and in a very short space of time, we had at least 2 admissions for GI bleeding, one of whom almost died of the GI bleeding. And the common cause? Ibuprofen. Right. So that was back in the 80s.
People
right?
have
What
no
were our
idea how
choices
dangerous
now?
that is even today, right?
Still is. It still is. In fact, actually, non-steroidal anti-inflammatories cause 30,000 deaths a year in this country. More people die of that than die of HIV.
And it's so preventable. There are just so many other options
That's-
which we're going to get to, right?
That's what we're going to get to. Exactly what. So I said, okay, I got to learn something different. I decided to study acupuncture. That was in 1990. So I said, I got to find some other modality that's not conventional medicine doesn't use. That's going to be safer and effective, and and so on. So I studied acupuncture, but I couldn't do acupuncture. In 1990, people didn't want acupuncture. They didn't know anything about it. And now you're putting needles in people's bodies, and they say, I don't want needles. I don't want needles. So then I discovered that in the Orient, they were using magnets on acupuncture points. They started using magnets. And I found that magnets stimulated acupuncture points very adequately. I actually did an EMG study looking at the use of magnets for acupuncture meridians and points. And it's been discovered that acupuncture meridians and points are actually are electrical. It's a DC current system. In Chinese medicine, they call it qi, because when they came up with the word qi, they didn't know what electrical was. Right? Exactly. At that time. So we now have clarified that, and magnetic fields interact with current. We know that. That's a basic principle of physics. That's why it's called electromagnetic. Where you have charge or you have electrical fields, you have magnetic fields. And magnetic fields interact with ions flowing in a wire to produce current, to increase the current production. And therefore, you can turn on a light. You put a magnet on a circuit, stimulate that circuit with a magnetic field. It's got no charge, no electricity going through it. Stimulate it with the magnetic field, and a light bulb lights up.
That is so fun to play with. You could do that all day long, right?
You could. Yes, it's a lot of fun.
It's so fascinating to actually see how much current is going through our body with those um, opportunities to play.
And it's not even just the nerves. We just think about it as the nerves doing this, but connective tissue conducts current. So when you actually contract your hand or your arm, current is flowing through that hand, through that arm, through the connective tissue at the rate of 30 meters per second, much faster than a nerve will conduct. So we're full of charge.
Well,
We're
and
full of electrical.
I love the research too on the heart fields too, right? Like our hearts make quite a magnetic.
A huge field. And there are machines to measure the magnetic field of the heart. There are machines that measure the magnetic field of the brain because they produce the most magnetic fields, the biggest. Even though they're very tiny, they're still the biggest magnetic fields of the body. And we can now quantitate that.
It makes you think about the human body in a totally different way to realize what we really are, right?
Absolutely. In fact, along the way, I really got to realize that we're not just tissue. Tissue is, you can, bring up your skin, right? You touch and you feel tissue. But what makes up the tissue? Molecules, right? And the molecules are chemistry, right? And what controls chemistry? Physics.
Physics. Yeah.
Sodium and chloride cannot dock to make salt without the physics allowing it to happen. So magnetic field therapy basically is working on a physics basis, primarily affecting the chemistry, which then affects the tissue.
Makes so much sense that we can use this technology to help our fields improve.
Our fields improve and our bodies improve as a result.
Exactly.
Like we were talking before we started about a 3-year-old girl. So we talked about magnetic field therapy decreases inflammation, which is a whole important basis behind its effects for benefits for mold and mycotoxins. But in that particular case with the child, a 3-year-old child, cut off the end of her thumb in a door jamb. We totally severed it. And so the surgeons would normally just clean it up and put a graft on it, cover the wound. So I said I knew that there were cases or histories of people regrowing, regenerating. And we know salamanders do that. So humans retain a little bit of that capability of salamanders up to about age 11 or 12, especially beyond the first joint. So I said, okay, well, thinking about that principle, why don't we just put the cut off piece back onto the thumb as a bandage, right? Just to preserve that wound, and then stimulate it with magnetic field. So an hour to an hour and a half a day. And literally, so it's gone. It had to regenerate completely. She lost her nail, clearly. You expect to lose a nail. At 12 weeks, she was regrowing her nail.
What a lucky little girl to have a dad that was so willing to
on target, on time, and was willing to help her do that. Unfortunately, she could have done more stimulation and healed even faster. But an hour and a half a day for a 3-year-old child is not bad.
That's a lot of time to sit still, isn't it? Yeah. So that really got you moving on this technology and wanting to delve into it and understand it even more.
Well, that was like a mind-blowing effect, because how often have you seen that, a regenerative extremity, right? A
Pretty
piece of an
exciting.
extremity.
Yeah. So if you can regenerate that, a body part, what can you do when there's been injuries
inside the body?
places?
Exactly.
Yeah.
Especially when you're talking about the liver, for example, which has tremendous regenerative capacity. If you stimulate that regenerative capacity, then what can you do? But I've certainly seen a lot of other sort of regenerative cases with magnetic field therapy. So whatever the damage is in the body, whatever causes that damage, the magnetic field therapy can help it. In some cases, it can reverse it, like it did with that little girl, if you have removed the cause. If it's an injury, you remove the cause. The injury is done and gone, right?
Right.
But if it's mycotoxins, you have that continuous exposure, or you have the spore reactions in the body that continue for time. You can't get rid of the spores entirely. So basically, you're having to continue to do magnetic field therapy to keep up with the damage. But in some cases, if the damage is gone, you can regenerate just completely.
Mhm. Do you want to explain to the audience a little bit about the effects of mold and mycotoxins, the way you see it in the body, the way that you've come to understand it for your patients?
Sure. The way it's pathophysiologic. So I think in terms of physiology, how's the body functioning? So what's the damage that's impairing the functioning of the body? So mold by itself is not as much of a problem, but mold tends to cause more respiratory issues or more contact issues with the skin. But the mold isn't so much. It's the mycotoxins. Now, not all molds release mycotoxins, and not all molds release heavy amounts of mycotoxins. But it also depends on the sensitivity of the person. So mycotoxins can affect virtually all the organs of the body, but especially the liver, the kidneys, the immune system, the respiratory system, the brain can be very
Right.
much affected by mold,
The brain is a
mycotoxins.
really big one, so common.
And it's a huge one that causes most of the chronic problems that people have with that. But mold also, the mycotoxins also create autoimmune reactions. They create immune reactions because when they create damage to tissue, then the body says, this is not me anymore. And the body begins to attack that part of the body, whether it's the thyroid or the skin or the brain, kidneys, you name it. So anything can become autoimmune in the body. And from my perspective, autoimmune means whole body.
I
Whole immune system is involved because the whole immune system is the whole body, right?
Every cell in the body is
Is
aware of what's
affected by it.
going on, right?
So the biggest reaction with mold then basically is inflammation. And when you have inflammation, you have swelling. And when you have swelling, you have restrained or constricted blood supply. And now we know, evidence is now showing that wherever you have inflammation in the body, you can have local damage to the blood supply. So it's not like putting a ligature on an arm or wrapping a strap around an extremity or an arm and constricting the blood supply that way. We've all done that by sitting on our haunches with our heels up in our butts, right? And we
Right.
get the numbness and so on when we get up, that the circulation is restored. But this is local, and it's local in the brain, it's local in the kidneys, it's local anywhere in the body, it's local in the GI tract. So if you can reduce the inflammation, you improve the circulation and you can then improve repair. Because if you have restricted blood supply, you can't regenerate because you can't get the growth factors into that area to regenerate that tissue. So that's basically the concept that I have with mold and mycotoxins. Is this the damage? And what you're dealing with that is to try to keep that damage constrained and help the tissues to recover or maintain at least, right? At least to maintain.
Right. And, a lot of times it really does take time for people to figure out the source of the mold and get remediation done or move. And then also to get the toxins out of their body so that they can heal. So I love this theory that you have and what you're seeing happen with all the data where it really does boost the body's ability to get that repair going during that whole process that it really takes to recover.
Unfortunately, it does, as you say, it does take time. Healing does not happen overnight.
Right.
If you break a bone, it's not going to repair overnight. There's nothing I can do that I've ever seen happen to repair a bone overnight. Even that little girl took 12 weeks.
Are you tired of living with chronic pain? Medication only masks the symptoms, but real healing starts at the cellular level. I'm Dr. William Pawluk, the leading expert on PEMF therapy. Pulsed electromagnetic field therapy is a science-backed, drug-free solution that helps reduce pain, speed up recovery, and improve overall health, right from the comfort of your home. Take advantage of an exclusive 10% discount on drpawluk.com PEMF systems. Visit drpawluk.com, that's drpawluk.com, to register and claim your savings. This limited time offer is available only to registered listeners. Don't miss your chance to experience the benefits. Terms and conditions do apply. Don't just manage pain, transform your health. Visit drpawluk.com today and let's get started on your healing journey together.
So let's cover a little bit about what PEMF is and how it works.
We know about EMFs. Everybody's worried about EMFs. I call them environmental magnetic fields, but EMF stands for electromagnetic fields. So EMFs are environmental, and they are basically broadcast into the environment. So you got a microwave tower that's broadcasting a cell signal, or you have radar, or you have television signals, or you have radio signals. They're all broadcast in the environment. They go out into space, basically. They bounce off the ionosphere. And the reason they're a problem is because they're high frequency, typically. And that means that they get absorbed by the body. So whatever is in the way of that field, whatever stands in the way of that field is going to absorb that energy. And so that the EMFs, because they absorb, they create heating. And the irritation, the signal is irritating to the DNA. It could disrupt DNA. So that's why those signals can be harmful to the body, especially high intensity exposures or chronic long-term exposures.
And I want to come back to this in a minute, because now that we've opened this
This box?
this box, we should probably come back to it a little bit. I have some personal experience with living very close to six for a couple of years, and they weren't right in my line of view, but I definitely felt better when I moved. I mean, I literally had to move.
Absolutely. So it's chronic, and it also comes in bursts. It's not necessarily doing it all the time. Those are environmental, and they create heating, which means they create damage in the body. And you could tell, for example, with a cell phone, if you hold the cell phone to your ear, it's actually cooking your ear, and it's cooking your brain. If you take the cell phone away from an ear that you've been holding it against, it's going to be bright red.
That's true.
You look at the opposite ear, and it's not bright red. So you really are cooking with a cell phone. So if you get bombarded then with all these waves, they're cooking, just like a microwave oven does, right? So it's the degree of exposure, the intensity of the exposure that becomes potentially the problem. But that's EMFs. So PEMF stands for pulsed electromagnetic fields. They're still electromagnetic, but they're pulsed, and they're not based on frequency at all. So the fundamental concept is that current's flowing through a wire. Let's say my thumb is the wire, and the current's flowing through the wire. Every time the current sort of pulses into the wire, a magnetic field is produced. It goes out, and it collapses right back on itself. It does not broadcast. It can't keep going.
More like ocean waves kind of coming into the
into the shore.
Into the shore,
exactly. Yeah. Although an ocean wave started out in the mid-Atlantic, right, or mid-Pacific, is going to be that's a bit different. So these fields then, because they're pulsing and closing back and forth, the level of exposure is significantly less. And as that magnetic field goes out, it goes into space. If you happen to put a body in the way, then that magnetic field can go through the body as if it was space. The body does not stop or use up a magnetic field. So we use that principle then, because it's pulsing at a rate that is safe for the body. As it pulses into the body, think of it this way. It's like the wind in the trees. You can't tell the wind is there unless the leaves are moving. There's air movement all the time, and it's just passing through the tree. It doesn't stay in the tree. The tree doesn't actually restrain it and absorb it and use it. It does to some extent, but basically not. So magnetic fields are like that. They're basically like the wind blowing through the cells of the body, blowing through the tissues of the body. They go right on out, and they come right back. And that principle is very important, because that means they're extraordinarily safe. And as they're passing through the body, like they're jiggling the leaves and the branches of a tree, they're, in a sense, they're not really jiggling directly. What they're doing is they're interacting electromagnetically. They're interacting with the charges in the body, the light bulb being turned on by magnetic field going past the coil, right? So the body's electric. So as the magnetic field moves into the body, it's then increasing all that charge in the body. And that charge in the body, that energy that's produced in the body, creates change. And in my book, Supercharge Your Health with PEMF Therapy, and also in my first book called Power Tools for Health, I outline all the different actions of magnetic fields in the body. It's not disease-based. It's not like you got a headache, you take an aspirin. It's not like you got a kidney problem or an infection, you take an antibiotic. Magnetic fields are generalized in the way they work. They don't care what the cells are, right? It's the cell that determines how the magnetic field is going to, how much energy is going to be produced, the kind of energy is going to be produced, and the kinds of chemical reactions are going to happen, the kinds of neurochemical reactions are going to happen. So the skin doesn't produce a whole lot of neurochemicals.
So would you say that the way that it works is actually helping the cells to have more resources to do their jobs better?
Couldn't have said it better myself. Thank you.
Okay, awesome.
That's exactly correct. So the cell now has more resources to do the work it needs to do. And we can always improve the amount of energy in our cells. Always. Now,
Yeah,
there's a limit to how much we can produce, but we could always use more. And the reason we age is because we don't have enough.
right. Right. The wear and tear of living
Living
in
here
today's world,
today.
right? Where the all the different toxins and the depletion in the food supply to have optimal nutrients to run things, the stress, the probably the EMFs, all the different things are
All EMF is just another stressor, right?
right. So this is exciting. So can you talk a little bit about how somebody with chronic illness or mold exposure might want to use the equipment if they had it?
So yes, I think the decision is always going to be whether you go somewhere to get treatment or whether you do it yourself. Usually when you've had chronic mold exposure, you're going to have reactions in your body that are going to be long-term, if not lifelong. And then like autoimmune. If you have an autoimmune process going on, you have a lot of inflammation and you have all the reactions to the inflammation and the damage in the tissues and the physiologic derangements that happen. That means that you're going to need to be doing magnetic therapy for the rest of your life, most likely. Now, if you don't,
Well, based on what you're saying, it sounds like everybody should.
should anyway,
Yeah.
whether it's mold exposure, mycotoxins, or any chronic illness. After age 40, what percentage of the population has a disability?
It's getting higher every day.
All the time. Yes.
And
So at
even
age
in
40,
children,
something like 20% of the population has at least one disability.
right? And what we're seeing with children these days too, with the autism, ADD, ADHD, all the increase in diabetes, all the autoimmunity. It's even like with what's happening
Even
with
worse.
kids.
You talk about glyphosates and things like that, then yes. So we're all constantly bombarded. That means since we're constantly challenged, we need to amplify the benefit of or whatever's going to keep us as healthy as possible. I know a plastic surgeon at Virginia Beach who discovered that if he doesn't get people on a diet, on a proper healthy diet for at least 3 months before he does a surgery, they don't get the same results. So he basically now requires all his patients to be on a whole foods diet, a healthy, balanced diet for at least 3 months before he'll even do the surgery.
I love that.
Right? For the reasons that we're just discussing. Everybody can use improvement.
Yeah.
And then if you improve yourself to an optimized perspective before you create stress to the body, like surgery, right? Then you're going to recover better faster. And you don't leave things to chance. So right now, if you have a procedure, if you have an appendectomy, what does a surgeon do to help you to recover from your appendectomy?
Nothing.
Zero.
Yeah.
Actually, that's not true. This is what the surgeon does.
Right.
You cross your fingers, right? So you're leaving things to chance. It's going to be up to you to recover. I've done my part. You do your part. So what we're doing with magnetic field therapy is we're decreasing the chance factor. We're giving you a much better opportunity to be able to maximize and optimize what it is your body can do to help you to repair and recover, whatever the causes of the injury, the damage to the tissues, are.
That's great. So, people have the option of finding a practitioner who has one in their office, or they can get one to have at
Or
home.
get one on their own. So on drpawluk.com, we provide consultation services for people free, give you advice on which system you should get, because there's lots of choices,
Okay.
and it's very confusing. Unfortunately, there are people who do multi-level marketing who are selling $6,000 machines that do almost nothing, right? And why? Why do I say almost nothing? Because it's all about the intensity. And I get into arguments with people all the time. Well, it's about frequency. I said, no, it's not about frequency. That principle that I mentioned with the coil and the light bulb, with the magnetic field stimulating it, the stronger the stimulation from the magnetic field, the brighter the bulb is going to be, the more charge or energy you produce in the tissues. Well, that's clearly very important in our bodies as well. So if you don't have enough charge in the body, then you don't get enough benefit in terms of optimizing the body. So intensity is the most critical factor. And that's based on something called Faraday's law.
Okay.
But there's another factor. So even if you have if you have a machine that's better than 1 Gauss, which is what these multi-level marketing machines are, 1 Gauss, Gauss, is the measure of the magnetic field. So research has shown that you need 15 Gauss optimally at the adenosine receptor. So the adenosine receptor is on all white blood cells. And where in the body are the white blood cells? Everywhere, right? So wherever you have inflammation, you have white blood cells. They're coming to help. They're coming to the party to help. But you need to have 15 Gauss to stimulate the adenosine receptor. But the problem then is that magnetic fields, like any other radiation, whether it's cold radiation or heat radiation or light radiation or magnetic field therapy, which is not ionizing radiation, all radiation is subject to another law of physics called the inverse square law. So like we do in medicine, if you're going to get radiation therapy, you have to calculate the dose of the radiation at the depth of the tissue you're trying to treat. And that's based on the inverse square law. So in my book, Supercharge Your Health, and on the website, I have a blog about adenosine and the relationship of adenosine to inflammation. So then we have tables to show you what magnetic field intensity you need based on where you're trying to treat. So if you have pulmonary problems, significant pulmonary issues, whether it's like, say, recovery from COVID, or whether you have asthma, or whether you had pneumonia, all of these things, then you have to calculate the dose of the magnetic field in that tissue. So for example, if you are trying to treat across the brain, from one side of the skull to the other is typically around 6 inches. So in order to go across the brain with the magnetic field to stimulate inflammation on the other side of the brain, you need about 4,000 Gauss. 4,000. And I go into that in the Supercharge Your Health book. I have tables about different kinds of magnetic devices and how they work for different conditions and recommendations for specific conditions. And that's all based, again, on the intensity rule. So there are people out there who are selling, again, usually multi-level, that are saying high intensity is bad for you. It's harmful. They don't care about the science. They're trying to sell a machine that's too weak. So they say frequency is more important than intensity. Well, from their perspective, frequency is all they have. They have intensity. But we now have machines that are approved by the FDA to treat treatment-resistant depression, and they are treating the brain with about 8,000 Gauss.
And you need to see a healthcare provider for that, right? That's
For that.
the thing.
I'm not recommending that for you.
Okay.
I'm saying that you get the right intensity machine for the problem that you're treating, right?
So
Then it's going to be safe. It's not harmful.
But there are some things that people could do at home if they understand how to do it and what they actually need for the particular area that they're wanting to address. Then
Absolutely.
there are a few things that it's really better to work with the healthcare provider to get the optimal treatment.
In some cases, if it's a short-term benefit, so if you do have pneumonia, whether it's mycotoxins or not, but if you get pneumonia, then you want to help the body to heal from that pneumonia. If you just had surgery, you want to help the body to heal from that surgery. The treatment in a provider's office will work because it's short-term. You only need it for a short period of time. But when you're dealing with a chronic problem, if you stop the therapy, the problem comes back because you can't heal the tissue completely. Then you need to do home treatment. And besides that, even if you're doing home treatment for a lung problem or a brain problem, or again, autoimmune problem, you're going to need it for life anyway, because all the other things that magnetic fields do are going to happen too. So they're not only going to treat that problem, but they're going to support your general health.
Right. And so for somebody that just wants to be proactive and preventative, what are your thoughts around that?
Well, absolutely. So my response typically is we have about 100 trillion cells in our bodies. How many biochemical processes happen in every single cell per second? Thousands.
Yeah.
Thousands of biochemical processes are happening constantly in the body.
Yeah.
Right? So how much treatment time do you need? I don't know. Your body's going to tell us.
Right.
Right? So I say I probably at least half an hour a day. So somebody who tells you only need 3 minutes a day or you only need 8 minutes a day, garbage. I can use a stronger word. Garbage. You need what you need.
Right.
Right? And your body's going to tell you what you need. So if we listen to our bodies, we say, okay, I need half an hour. If you do half an hour of treatment and you have pain and the pain comes back 4 hours later, well, then obviously you didn't treat long enough.
Right.
As you could treat again in 4 hours. As you continue treatment, as you begin to get the healing going on in the body and significant reductions in the inflammation, then you can then begin to stretch out the treatments, to be less frequent. But if you're doing health maintenance, you need to do it every day.
Okay. And is there a time of day that's better than the other? Is it like the beginning of the day or the end of the day?
Not really. Not really. Although I do recommend that for health maintenance purposes that we should be doing magnetic therapy in the morning for sure to get rid of the cobwebs from the night before.
Oh,
Right? You just wake the body up after sleeping all night, been laying down for 6 or 8 hours, and you're not moving a whole lot. Things have slowed down a tremendous amount. So you got to wake things up. So the morning is a good time as well. At the end of the day, is there any day that goes by that we live that we don't have physiologic, at least, stress?
would be nice to have a few of those.
Well, they're pretty rare, very rare. But even living a day basically uses up energy, uses up food, uses up all the processes in the body get used up as the day goes on. So basically what you might want to do at the end of the day is to wash the stress of the day out of your body. And magnetic fields have been shown to do that. They
Uh,
accelerate the elimination of adrenaline out of the tissues.
that analogy is beautiful. So you mentioned treatment resistant depression. I noticed on your website, your last blog is on stroke. Are are there any other things that you're super excited about how um, to consider using the PMF?
Well, the most common use of PEMFs is pain because pain drives everybody. 60% of the reasons for the visits to primary care doctors is because of pain. So pain is a strong motivator. Pain by itself, and you want to get rid of the pain, but in order to get rid of the pain, you should get rid of the cause,
Exactly.
right? You need to repair the tissue. Otherwise, it's a constant. That taking ibuprofen for chronic pain is not going to solve the pain problem, causes new problems, right? So basically, pain is the biggest one, but it doesn't matter which organ in the body is involved. So we do headaches, but in addition to pain, we do physiologic issues. Like I dealt with somebody yesterday who had cirrhosis. I recently was talking to a woman who had Crohn's disease. So, and significant Crohn's disease, and nothing in medicine is helping her to heal herself from her Crohn's damage. So it really doesn't matter. You can treat any physiologic function. That's why I go back to the 27 different actions of magnetic fields. It doesn't matter what the tissue is. It doesn't matter what the disease is or the problem is. All of it can benefit from PEMF therapy.
Well, I'm starting to think we all need one. We all need one at home so we can do it every day, right?
Well, ideally, and you need the right one. So that's the key, really.
Well, let's talk about that a little bit more about of what some of the right ones are out there to choose from.
All right. So in the book, Supercharge Your Health, I have tables, a table of the different devices. On drpawluk.com, on the home page, there's a tab you can touch called Product Comparison. It gives you a long list of all kinds of devices, from very weak, very mild, very small, to very powerful and very large. So there's a spectrum. The most common mistake people make with magnetic field therapy is that they tend to buy based on price. They don't buy based on the condition or the cause or the intended treatment. So if you're only buying it based on price, you're usually going to spend a very little amount of money, $500, $600 for a machine. It's not going to get you very far. Now it's going to be okay for a tennis elbow or arthritis of the wrist, but it's not going to help the whole body that much. So you're getting the right machine. So if you're going to make an investment, I would suggest thinking in terms of not only the current situation, but what are you going to need 5 years from now, 10 years from now? What do other family members need? Right? And you may be able to do carpal tunnel with one machine, but your knee is a bigger area, and you may need a much bigger, stronger machine. So you kind of have to think about the totality and the person. So if somebody comes to me because they got Crohn's disease, but they also have osteoporosis, then what am I going to treat? They need something because they think they need something for the Crohn's disease. That's the priority for them. They kind of forget about the osteoporosis. So my job as a holistic physician is say you need to look at the whole person and what's going to drive the decision for the equipment. Well, the osteoporosis is going to require a much stronger machine that's treating the whole skeleton than just treating something for the belly itself. Now, obviously, people, don't always have the resources or the money, or they may not even have the time. So you do what you can, but you may have to continue to keep in mind you as a person. And the toe bone is connected to the head bone.
Yes, and the whole body seems to really know what's going on everywhere. So it's all, we think that the mouth is separate from the rest of the body. Well, no, it's really informing everything, everywhere. That immune system is traveling everywhere. Um, so let's go back to the EMF for just a second.
All right.
So since we talked about it, so there's so much data behind the PEMF as being safe, and there's a lot of questions and doubts about EMF. So a lot of people still really don't understand that it can be dangerous to live next to cell phone towers and hold their cell phone up to their heads.
Or keep their Bluetooth in their ear.
Yeah. So I'd love it if you just maybe give your top 5 tips for managing EMFs and keeping your body safe, your children safe, kind of thing from EMFs.
Well, number one is what you said. Know where the cell phone towers are,
Mhm.
right? If you have one within 2 or 3 miles of where you're living, then you're getting a lot of EMF from those cell towers. And they're somewhat 360, but mostly they bombard in a, like, let's say a light stream. They go out in a cone. So towers are important. 5G is, while it's touted to be really a big thing, the biggest problem with 5G again is where's the tower,
Mm.
right? And 5G, because it requires a lot more energy to produce a 5G signal, you need a lot more towers. And most of those towers are smaller and they're in the local neighborhoods,
Okay.
right? So you have to kind of know where your 5G transmitters are to be able to decrease your exposure. One of the most common exposures that people forget about is the what do they call those, utility meters, smart meters.
The smart meters, yes.
Smart meters are really dangerous because we kind of neglect them and forget about them. If you have a smart meter on your home, get rid of it or move.
Hmm.
Right? The solution for a lot of these problems is move, right? Which is not that easy. Easier said than done. But if you have one, get rid of it, and you'll have to get a meter that basically they have to read. Now, not all
Fashion way.
places will allow you to do that. Most places in the country now do. You're going to have to pay an extra fee to get rid of that meter. If you're living at the end of an apartment building or a townhouse building, they often have the meters in a row at the end of the townhouse. If you're next to that meter bank, you're really getting fried.
Okay. So I know some people that I know have some type of like a kill switch that they do at night to turn off a lot of the power in the home. Do you feel like those work?
Yeah, so Wi-Fi is a big one. And it depends on the strength of the Wi-Fi signal. So if you happen to have a Wi-Fi signal in a room next to your bedroom, you got a problem, Houston, right? So that's a big one as well. If you have a big house and the Wi-Fi bank is the router is at the other end of the house and it's 100 feet away, and you're going to get some exposure, but you're probably not going to get a lot. But if you have mycotoxin already, or if you have an autoimmune problem already, your body's already lit up. It's already being sensitized because the nerves are jangled and irritated with the inflammation. Well, then, yes, you should probably turn it off at night. In Europe, we don't have those here, but in Europe, they have demand routers. They only turn on when there's a signal coming through.
Oh, that's interesting.
The same thing with cell phones. Cell phones, when you're not using it, you're not getting a signal coming through. It's an resting state. There's very little being produced by the cell phone. So it's only when it's active that you're actually getting exposure. So obviously, should not have your cell phone by your bed. You should, if you're going to have a cell phone in your bedroom, ideally it should be on airplane mode. But I've also discovered recently that my text messaging is still coming through, even if it's on airplane mode.
Oh, yeah.
Right?
Out,
So
out of,
you probably
out of
should
the
not be in
bedroom.
your bedroom at all. Far away, as far
You're
away,
definitely not wearing it on your body, right? Men need to not
and
be putting.
absolutely not wearing on your body. They should not wear it on your body hours and hours and hours and hours a day. And when you're using it, you should use the speaker or use wired buds. Now, if you have wired buds, then you're going to have it on your body in order to be able to have the wire connection.
Right.
Okay, well, you have to make those trade-offs. Bluetooth is better than the cell phone, but it's still EMF. It's very weak. And the same thing with the earbuds. They're still producing a magnetic signal, electromagnetic signal, but it's much weaker rather than having the cell phone. So the best of all is the tube type
Right.
ear connectors, but the signal is lousy. The hearing it is absolutely horrid. So that's not really not a good solution.
Defeats the purpose a little bit. So
speaker is probably the best way. If you
speaker
can
it
do
is.
it, speaker, do speaker.
Okay. Well, I love this conversation in that we can use electromagnetic fields really favorably for positive influence on our electromagnetic fields or detrimentally, and that there are action items that we can take that really maximize those benefits. It's really
Well, you have to understand your technology. You have to understand the benefits and the risks. Now, actually, to get back to that topic, how can you help yourself other than removing it, which is the best thing to do?
right.
Right? You can't remove it all, right? So the best thing to do to protect yourself is to do PEMF. So if you're doing PEMFs twice a day, whatever harm you had from those signals, whatever stressors you had and inflammation they may have caused in your body, when you do magnetic field therapy regularly, you're washing all that out of your body. All right. So magnetic field therapy by itself is protective, but it's not. It doesn't eliminate it. It doesn't block it. You can't block these signals. When you leave your house, they're out there. They're everywhere. You can't. Unless you want to wear an aluminum helmet.
Yeah, I do know people that have built like Faraday cages over their bed and
Right.
and
Which
bit of
it's just
fun.
a bit extreme, and even they don't help that much. They help somewhat, but they're not completely because unless you create a complete cocoon, if there's any way, if there's any gap in the cage, the signals get in.
Your body was designed to heal, but illness, chronic disease, stress, injury, and time can slow that process down. What if you could restore your body's natural ability to recover, recharge, and feel its best? The key to healing is giving your body the energy to repair itself. PEMF therapy does exactly that. Recharging your cells, improving circulation, reducing inflammation, and helping you function at your best. For decades, I've studied this technology, worked with hundreds of medical professionals, and helped thousands of people reduce pain, regain energy, and take control of their health. However, not all PEMF devices are created equal. No one size fits all. We offer personalized consultations so you can find the right device for your needs, backed by real science and trusted results. If you're ready for a real solution, let's talk. Schedule a consultation at drpawluk.com. That's drpawluk.com, because real healing starts at the cellular level.
I really, I appreciate that. As long as this has been around, that it's still somewhat of an evolving field, and I think the 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 way that technology is going, there's probably more things coming that are detrimental, but then also more and more things coming that are protective and helpful. So it'll be people like you that help to integrate all that information.
We could repair. We could repair. So we have the choice. We have the ability to repair. It's our choice, right?
Yeah, it's so interesting. I was just at a a medicine meeting down in Florida, and after a day of being there, I remembered what it was like to living in mold. My body was so achy, I could hardly move. I wish I had one of those PMFs
Take with
with
you when you go to a
with me to
conference. Yeah.
go, right? But instead I packed my bags and left, which was ultimately probably the best thing. And fortunately, they were recording the conference, so when they release the recordings, I'll get to go back and listen to the lectures that I missed. But I missed the getting to see more of the
The
people.
interaction.
Yeah. Yeah, so I mean, I think it was one of those mold situations that was just horrendous. I was not the only one um, that either couldn't attend the lectures or had to leave, and so hopefully they'll do better picking a safe place the next time. But it was fascinating how quickly the inflammation went up in my body and just was screaming at me.
Well, it's not only the mold, right? It's all the EMF in that environment as well. Hotels, they produce very big Wi-Fi signals, right, to reach all the spaces in a hotel. So you got the mold, you got the dust, you have the sound, you have the air. There's all kinds of things that are going on in those kinds of closed environments that activate the inflammatory processes in the body.
Yeah. Yeah, this one was definitely primarily for me, the mold.
Mold.
You could smell it. Yeah, and it just reminded me of the old days when I was like, would wake up in the morning just feeling like I was run over by a truck, and I didn't know how I was gonna get out of bed and take care of my kids and get to the office and all of that. So, fortunately, I d
Well,
d
there are some small PEMF devices that are relatively affordable that are battery operated. So one of them is called the Flex Pulse. The Flex Pulse was not cheap. It's $1,290. Um, and it is portable battery operated, and it has 10 programs in it. So one of the programs is 10 hertz. There's another one that's 7 hertz. People who are into the Schumann resonance, 7 hertz is Schumann resonance. 10 hertz has been done on repairs. That little girl with the thumb used 10 hertz.
Mm.
So 10 hertz, 10 cycles per second or 10 pulses per second, then is restorative. You can actually wear it. And I've had people who basically put it on the base of the skull, which gets your autonomic nervous system and therefore your vagal nervous system. It stimulates the vagal nerve, which then calms the autonomic nervous system down, rebalances. At the end of the day, you can actually put it on your pillow, inside the pillow cover, and run it all night long on program 1, which is Delta, for sleep.
Oh, that's beautiful.
Right? And if you're flying across the country, if you're flying from west to east, you're losing time, and the stress of travel by itself, you can actually take that a theta program on that machine and put that at the back of your neck, and that could keep you very relaxed. When I fly overseas or I'm doing a red eye, I will put that one coil on the base of my neck on Delta, which is program 1 on FlexPulse, and I call that flying Delta.
Oh, that's awesome. I'm gonna order one of those. I've got a trip coming up that's gonna be about 24-hour journey, so
Oh dear, well that's really bad. Then yes, FlexPulse is really great for that.
well, and then it took me about 3 days to feel like myself after this conference. I was bumping up my detox and, doing the, anti-inflammatories, but I probably would have been fine right away if I had added this on top of it.
You had that before, and what you could do actually too is you could use the coil, one coil, right over your thymus to
It
stimulate your T cells in your body.
Nice. So, yeah, that's probably a great idea to include on a regular basis as well, just to keep the immune system
System
happy.
charged up. Yes.
Yeah. Well, I would love it if you would just, for the people that are listening that are, still in the thick of things with their chronic illness, the mold and mycotoxin exposure, like what inspiration can you give them on their healing journey about getting to the other side?
Clearly, it's multifactorial. You have to do multiple uh, strategies. It's rare that you're going to find a single strategy that's going to solve all problems. You can't do magnetic field therapy by itself, like that surgeon, the plastic surgeon. Nutrition is very important. You can't rebuild a tissue unless you have the nutrients to rebuild tissue. You have to have adequate protein. You have to have adequate minerals. You have to have adequate fats and sugars and so on in the body. A good balanced diet. So balanced diet becomes very important. And magnetic field therapy will work better if you have a balanced diet. So that's another aspect of it. And regular use. Thing is, you need to do it regularly. That's why I don't recommend going to a doctor's office most of the time, unless you have an acute issue that's going to resolve itself rapidly. One of the most common sources of referrals to me, actually, the two most common reasons for people to come to get a consultation is, number one, they've been to a doctor and they feel an experience they feel a benefit from the experience of the doctor's office. And then they realize they have a chronic problem, that they got to get their own machine. The other one is that people who buy these from multi-level marketing companies buy these very low intensity machines. And they realize you're going to spend $6,000 for a very low intensity machine. You may have to spend $7,000 for a right intensity machine. It's going to cost you a bit more, but you're going to get something that's going to be much more effective for you. And magnetic field therapy is not just for you. It's for the house.
It may
So
be the neighborhood.
Well, if you want to, it's your choice.
I don't know. The word might spread.
It's your choice. So I tell people, when you buy a magnetic therapy system, you don't own it. The house owns it, including the dog, the cat, and the plants.
Beautiful. Yeah. So let's let the listeners know how to find you again, and the books, the website, and because I think there will be a lot of people that will want to know more about the information that you put out there on this important mission that you're doing.
Exactly. Thank you. So the first one is drpawluk.com. That's drpawluk.com. And that's free. But there's a ton of information, and a lot of people find it overwhelming. But there's a ton of blogs, a ton of podcasts, a ton of videos. So you can take a vacation on drpawluk.com. It'll use up a whole vacation.
Instead of Netflix binges, you can do Pawluk binges.
I feel sorry for you if you did. But yes, if you're suffering and you're not feeling well, then yes, you'll find lots of resources to help yourself. The book that's the most practical is called Supercharge Your Health by Dr. Pawluk. And it's more of a manual, and it's an active resource. And it really helps you to understand how to use magnetic fields. And I've got specific advice on any different health conditions, including supplements, including herbs and supplements at the end of each recommendation. So that's a very useful book. If you want the science, if you're a skeptic, if you have people around you who are skeptics, like many doctors are, then especially your doctor. But if you bought one of the books, if you bought the Power Tools for Health book, and your doctor's a skeptic, bring the book to the doctor. But don't be disappointed that they won't reach for it, right?
Yeah.
So Power Tools for Health has the references. There's 500 references on it. Has more of the science.
I love that you've got the academic background and the science all wrapped into this big heart of yours that's on such a beautiful mission. Yes. Thank you so much for joining us. And I hope this is really helpful for everybody listening.
I hope so as well. And thank you again for inviting me to have a chat with you.
It was so much fun. Thank you so much.
Thanks for joining me on the PEMF Effect. I hope today's conversation gave you new tools, insights, and inspiration to take control of your health. If you enjoyed this episode, don't forget to subscribe, leave a review, and share it with someone who could benefit from PEMF therapy and holistic healing. Your body has the power to repair, recover, and thrive. Sometimes it just needs the right charge. Until next time, stay curious, stay proactive, and keep powering up to better health.